The elderly and their medication. Explaining issues of prescription drugs in the elderly. The first step to explaining issues is to identify if they are at risk. Do they live alone? Do they take multiple medications? Are they easily confused or simply not as sharp as they used to be? Do they visit multiple doctors or get prescriptions from multiple pharmacies? If so, watch the rest of this video. The first issue to explain is medication adherence, or taking the correct dose of the correct medication at the correct time. There are several reasons for not adhering to a medication. Perhaps they are not able to clearly read the instructions on the pill bottle. The solution to this is to ask for the prescription label to be in large print or to have someone read it to them. Perhaps they suffer from memory loss or forgetfulness. As a result, they forget doses or double up on doses by mistake, both of which can be fatal. The solution to this is a pill organizer, an alarm, or both. Lastly, perhaps they simply cannot afford their medications. However, several name brand medications have lower cost generics. The next issue to discuss is the use of high-risk medications. There are several medications that can have life-threatening side effects. The first is the use of sedatives, which are often prescribed for sleep or anxiety. These include Ambien, Ativan, and their generic equivalents. Also carrying the same effects are medications used for allergies, nerve pain, and depression, such as Benadryl, Ditropan, Elavil, and their generic equivalents. These drugs can increase fall risk and provoke confusion due to the drowsiness they induce. Doctors commonly recommend stopping or reducing the dosage of these drugs. Lastly, be aware of possible drug interactions. For example, warfarin, a blood thinner, is the most common cause of medication-related hospitalizations in older adults. Warfarin has 208 major interactions, 399 moderate interactions, and 200 minor interactions. Since it is a blood thinner, the high-risk medication, it requires monitoring with regular blood tests. The last issue is medication theft. They can be stolen from people you know, people you live with, or anybody who has access to your medication. First, know which medications are targeted. Most common is Vicodin, Oxycontin, or any controlled substance. Second, take inventory of where and how much of a medication you have. Then keep that medication out of reach or in a lockbox. Lastly, if you carry your medication on you or in your purse, stay alert of your surroundings. It is possible to be robbed in a parking lot for your medications. If your medication is in your car, keep it out of sight and lock your doors. Remember, don't advertise your medication any more than you would a diamond necklace. You are carrying something very desirable and valuable. So to wrap things up, the major points in this video were to identify if an elderly person is at risk for medication issues, medication adherence, the use of high-risk medication, and medication theft. If you have any further questions on how to help the elderly with their medication, just ask your local pharmacist.